My name is Chantal Simony and I'm one of 3 consultant gynecologists working at Wessex Fertility. Wessex Fertility is a fertility clinic which offers treatment to NHS and privately funded patients. We have been an established clinic in Southampton for over 20 years, and Dr. Ingemels and myself took over as medical directors of Wessex Fertility in 2007. We understand that it can be a very anxious time trying to have a baby, and hopefully after watching this video we will have answered some of your questions. When you come for an initial consultation, we will take a history to find out exactly what the underlying fertility problem is. It may not be necessary to go on to have IVF treatment, and we do offer other treatments such as ovulation induction, intrauterine insemination and donor insemination if donor sperm is needed. At that first appointment, we will also undertake an ultrasound scan to ensure normal anatomy, and the male partner will undergo a sperm test to ensure that the sperm parameters are normal. If any of the tests that we undertake are not normal, we will then have a discussion with you at the appointment about the various treatment options available. During your fertility treatment, you will be seen by a consultant. Here at Wessex Fertility, consultants perform all ultrasound scans, they do the egg collection procedures and the embryo transfer. There's always an opportunity during the scans to ask questions, and we are very happy to answer questions for you at any stage during your treatment. You will then have an appointment with one of our nurses who will discuss with you how to administer injections and will answer any further questions you might have. It is important to remember that at all stages of treatment there is always either a consultant on call 24 hours a day to answer questions or a nurse, and we would far rather you contacted us than were worried about things at home. I would quote our current statistics, which are a clinical pregnancy rate of 31% across all age groups, and a clinical pregnancy rate is where a heartbeat is seen on scan at 6 weeks. If you break down the statistics into age groups, under the age of 37 years, your chance of a clinical pregnancy would be 45%. We do have success rates of 20% in the 40 to 42 year group, and there are also success rates in women over 42. However, we would discuss very carefully with you whether to proceed to treatment if you're in the 42 to 44 year age group. In order to find out more about fertility treatment, we do offer fertility seminars which are held usually every 3 months. We have held these in Southampton traditionally, but we are also starting to hold them in Bournemouth. These are informal evenings where we encourage you to ask questions and to interact with the various members of the team. Many patients have commented to us that they really appreciate being able to see female gynecologists during fertility treatment. We understand that this can be a very anxious time, and sometimes it's really helpful to have that female touch. I find it very gratifying that when couples choose to have a second child, they come back to us at Wessex Fertility. I think that speaks volumes about the level of care they received for their first cycle.